The following segment is sponsored by Providence Health and Services. This segment of Afternoon Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Welcome back to Afternoon Live. It's an often silent disease that affects millions of Americans, especially postmenopausal women over the age of 50. Here to share what you need to know about osteoporosis, we welcome the founder of the Oregon Osteoporosis Center, Dr. Michael McClung. Thank you for being here.
Yes, thank you.
Tell me about the basics of what we should all know about osteoporosis, even if it hasn't directly impacted us yet.
Sure. So osteoporosis is a problem that is the result of bone loss that begins at menopause in women and with aging in both men and women. That makes the tissue and the structure of the bone deteriorate, makes the bone be fragile, and predisposes patients to fractures or bone breaks, especially with minor injury like a fall or picking up a grandchild.
Oh man, gosh, isn't that so tough? And it really does impact women at a quite higher frequency than men, correct?
Much more so. So maybe half of women in their lifetime will have a fracture related to osteoporosis, and probably 20% of men are affected.
Are there any signs or symptoms that you can be aware of before, unfortunately, maybe having a fracture or a bone break happen?
Unfortunately, no. The bone loss happens without symptoms, but when a fracture occurs, then everyone ought to think that they've had a bone attack, and at least they need to be evaluated to determine if they are at high enough risk to warrant treatment to prevent the next fracture.
Okay, because if you've already had one event, does it increase your risk for...
Markedly so. So being old, having low bone density, having had a previous fracture, especially a recent fracture, are the strongest predictors of another fracture.
Okay. What are some treatment options, and how have things changed or progressed over the last couple of decades?
Yeah, well, when we started our center in the 70s, there weren't any treatments, but now we have treatments that slowed down bone loss, so it prevented the progression. But more recently, we have medicines that can actually rebuild the skeleton toward normal.
That's
and we
really
now
exciting.
know that beginning treatment with one of those bone building drugs for a year or two, followed then by a medicine to maintain that new, better bone, is the most effective way to treat.
And should folks just make sure that they're in close communication with their doctor, working with them to find the best plan for their individual patient?
Sure, there are guidelines about how management is done. Managing osteoporosis requires a life plan. It's not a short-term fix. It's a chronic problem that requires long-term therapy.
Are there any things we can do preventatively at younger ages to be better set up for the over 50 part of our lifetime?
Yep. Before menopause in women or in young men, just having a healthy lifestyle, good nutrition, exercise, avoiding harmful habits to bone like smoking. At the time of menopause, we can identify women who are at high risk for developing osteoporosis with a simple bone density test, and steps can be taken at that point to prevent osteoporosis from happening in the first place, which is a much more effective strategy than trying to fix it after it happens.
Just that knowledge can be so powerful. What about calcium? Is that something that we should think about in terms of supplementing?
No, it's a myth that osteoporosis is related to calcium deficiency. Having enough is important, but having more than enough isn't helpful.
Okay, and that bone density test can be so helpful for so many people.
That's the way we can assess someone's skeletal status and their risk of osteoporosis, or if they have osteoporosis, we can use it to assess their risk of fracture and help make decisions about which treatment or treatment sequence that we choose.
Okay, there are options. Hey, thank you so much for chatting with us today.
Right, thank you for letting me be here.
If you'd like more information about Providence bone density screenings, head to our website at katu.com. We'll be right back with more Afternoon Live right after.